Hey guys, this is a quick video I'm making for xxxild, but it's probably information that a few other people can use. I'm going to explain informed consent with regards to my previous video about the ment and how it's unique in that it has a lack of it. And so in the comments on my previous video, I tried to use the parallel of a different test that we would give people, a different assessment for psychotherapy purposes, and I said the Rorschach test, and I said what I would say when introducing it. Hey, this is an assessment for a jumping off point for maybe themes that come up when you are talking about your reactions to all of these ink blots, and there's no risks involved, but it'll just give us some themes to work with to see maybe whether or not we need to explore these things in your own life. Does that sound good to you? And so a client presented with that has the ability to say yes or no, I want to do this or not, right? So that, I guess, was too close to the psychotherapy procedures that I was talking about in my previous video to really explain informed consent. So I'm going to use a different example now, and that would be the example of chemotherapy. Okay, so an oncologist would come to a client and say, hey, based on these tests, we believe that you have this cancer. We've seen it with this, this, and this, right? And so we are recommending as best practices that you undergo this chemotherapy procedure, right? And this chemotherapy procedure has the possible benefits of your type of cancer going into remission and possibly you being cured. The risks of this chemotherapy procedure include other cancers, or in 5 years, like 20% of people either still have the cancer or they have died of cancer or related complications to this procedure. So you have an 80% chance of it being good for you, 20% not so good. How do you feel about undertaking this procedure, this chemotherapy? So, in the way that I just presented that, this hypothetical oncologist stated the purpose of the chemotherapy, the possible benefits of the chemotherapy, and the possible risks of the chemotherapy. And all three of those components are what is needed for informed consent. The oncologist is not allowed to lie to the patient and say that there is no risk involved. And the oncologist has to state the purpose of the chemotherapy in order to relate the possible benefits of it. Okay? So, when we're talking about the ment, as I explained in my previous video, it has deception built into the application of it. So you have to lie to your client and tell them that the test is for a certain thing when it's actually testing for a different thing. And the possible risk that they are not informing their client of is that if they score in a certain way, they are considered not credible for relating their own symptoms, and therefore that invalidates other tests that they've already taken as far as do they have a certain mental disorder that the criteria of which are based on self-report. So the risks that branch off from that are you could get less health care for that mental disorder, and you could also get less disability rating for the Veterans Administration or from Social Security disability. So there are big risks to taking this test that are not given to the people before they take it. Also, the purpose of it has to be obfuscated in order for it to work, right? And that's why it stood out to me as being something that was unique in the realm of psychotherapy. The closest analog I can tell you about that would be covert observation. This is a type of observation that you could use by, say, letting a client go to their next scheduled appointment for therapy, which is group therapy, and then looking from a different room or sitting in on that therapy and observing that client, even though they're engaged in a completely different therapy, you're collecting data on them as far as their behaviors within that group. Another covert observation that is, I think, the classic example of it is little Johnny in his class is reported to the school counselor by the principal because she's gotten so many complaints about little Johnny's behavior in class from little Johnny's teacher. So the school counselor goes in to the class as a helper, quote unquote, and nobody in the classroom is told what the school counselor is there for. And then the school counselor acts as though everything else is normal, and just records the things that little Johnny does in class, the behaviors, right? And then that could be used to inform what sort of treatments little Johnny needs, what sort of interventions Johnny needs in his classroom. And when that happens, actually, a record is created, and little Johnny's parents can look at it, and also, if little Johnny were to turn 18, he could apply for his own records and be able to look at it, right? And in the case of psychotherapy, patients are allowed to apply for a copy of their own treatment, and then when they receive this treatment, they're allowed to read everything that was written about them, right? It's in their healthcare records. They're allowed to have access to it. So the ment, being that it inherently involves deception, I don't know that the healthcare records that are generated for it actually outline how the client was deceived. So there are so many different informed consent problems with the application of the ment. And that's why it stood out to me. That's why I made a video about it. I truly believe that it is unique in the form of psychotherapy assessment that it is, because it inherently involves deception and a lack of informed consent.